Care Certificate was introduced in April 2015, and it is now expected of all those working as healthcare assistants and adult social care workers to undertake this learning as part of their induction programme. The Care Certificate was created as a result of the Cavendish Review, which was published in July 2013. This review was part of the response to the Francis Inquiry into the failings of care at the Mid Staffordshire NHS Trust. The Cavendish Review found that the training and development of healthcare assistants and adult social care workers was often not consistent or good enough. Cavendish proposed that a new certificate of fundamental care be created to improve this, and that led to the Care Certificate. The Care Certificate covers the learning outcomes, competencies and standards of behaviour that must be expected of support workers in the health and social care sectors. It aims to make sure that you are caring, compassionate and provide quality care in your work. The certificate builds on and replaces the earlier induction programmes Social Carers Common Induction Standards and National Minimum Training Standards. There are 15 standards that make up the Care Certificate. The standards take account of the Code of Conduct for Healthcare Support Workers and Adult Social Care Workers in England, the Social Care Commitment, which is the social care sector's promise to provide people who need care and support with high-quality services, the Chief Nursing Officer for England's 6 Cs. These are care, compassion, competence, communication, courage and commitment. You will be expected to undertake the Care Certificate if you are new staff, new to care, or employed as a healthcare assistant, assistant practitioner, care support worker, or you support clinical roles where there is direct contact with patients, an adult social care worker, or you are a home care worker. Other roles may be included where achievement of all the standards is possible, as some of these roles would be very different in health and social care. It is up to the employer to decide whether the Care Certificate is appropriate. However, to be awarded the Care Certificate, you must meet all the outcomes and assessment requirements. The Care Certificate applies across the health and social care sectors, is portable between sectors and organisations, is an assessment of both knowledge and competence. This means that you will cover the same areas of learning as all the workers who undertake the Care Certificate. You will be assessed on what you know and what you do to show you understand and can carry out the standards in your role. You could use the learning towards some existing qualifications in the sector, and you will be able to take your certificate with you if you move to another role in health or social care. This course covers the knowledge content of the Care Certificate, but the certificate cannot be completed based on the use of the online course alone. In addition to the knowledge content, the Care Certificate includes almost 50 areas of workplace assessment. Your employer has a responsibility to provide an induction to ensure that you have the skills, knowledge and understanding you need to do your job. The Care Certificate may be used as part of your induction, as it sets out fundamental skills that you will need to be competent when working in health and social care. Each standard must be completed and assessed before you work without direct supervision in any setting. This should happen at the beginning of your employment and can be done in a phased way. As you meet each individual standard, you could be allowed to do the areas of work covered by that standard without direct supervision, while still needing supervision in other areas. The Care Certificate is not a replacement for the induction and training which is specific to the job you are employed to do, and the employer and workplace where you work. The Care Certificate is not a licence to practice. Evidence of having met its standards might be used towards some regulated qualifications and apprenticeships in health or social care. It is your employer's responsibility to award the Care Certificate to you. While your employer should record your achievement, they should also provide you with a certificate as your own record. It is recommended that you keep the certificate as evidence of completion, as well as any additional documentation you believe would be beneficial to other employers. This will help avoid the need to repeat learning if you move to other health and social care roles, though periodic refreshers on some content may always be required. This will help avoid the need to repeat learning if you move to other health and social care roles, though periodic refreshers on some content may always be required. The online course covers what you need to know and understand for each standard in the Care Certificate. It has questions and activities for you to complete, to show that you have understood the information and how it applies to your work. Please note that by completing the online sections, you will not obtain a full Care Certificate until you have been assessed by an employer, and you may have to complete the training in full during your induction. You can print the work and certificate throughout the course to create a portfolio that can be shown to your employer, but some may not take this into account. All will not be lost. By completing this online course, you will have a good understanding of the sections and should fly through them if they need to be retaken. We hope that you find this course both informative and enjoyable, and we wish you the very best of success in your new career.